So thank you, Dr. Kinnair, for agreeing to discuss the case of Sandra Carr. Can we start with perhaps how you first met Sandra?
Well, Sandra had never really seen a psychiatrist before, so I first met her when she arrived on the ward. She had been detained in the community by 2 doctors and a social worker on a mental health act assessment and brought into hospital. So my first contact with her was when she arrived in hospital and when she was unwell. She'd never seen a psychiatrist before that, to the best of my knowledge, and so that was probably 2 weeks ago now. And when she first came into hospital, she was very unwell. She had clearly had a number of unusual experiences over a short period of time at home. She described seeing swirling patterns in the carpet that she thought were trying to communicate with her in some way. And she'd also talked about hearing voices as well. At the time that she'd been detained, she'd actually been picked up by the police, and she was intoxicated. She was drunk in public, and I guess was making a bit of a scene, which is why the police had been contacted. And when the police arrived, she believed that one of the police officers was actually her ex-husband. Now, her ex-husband was not a police officer and never has been a police officer, but she was so convinced that this police officer was her ex-husband that she was aggressive towards the police officer. And I guess that perhaps came out of some fear, because with her ex-partner, he had been physically abusive towards her. So I can imagine where that came from, and she was clearly intoxicated because she has had a problem with alcohol now for a number of years. However, on the ward, all of those symptoms settled down very, very quickly. So she came into hospital. She was clearly very unwell. She was having a number of psychotic experiences, by which I mean that she wasn't in touch with reality. But over the course of a few days, without any antipsychotic treatment as such, things improved. So the only medication that we were giving her in hospital was related to her alcohol abuse, because she has been drinking alcohol very, very heavily over a long period of time. I mean, she's told us that most recently it's been a large bottle of spirits every day, and she's been drinking heavily for many, many years. And because she'd been drinking so heavily for so long, we had to give her some medication to help her with the withdrawal from alcohol. And as usual, when someone drinks so heavily, they don't eat very well, so we've been giving her various vitamin injections and vitamin tablets. The vitamin injections are sort of to protect her, actually. The problem when someone stops drinking very suddenly is that it can have quite a serious effect on the brain and can cause, I guess, a syndrome that resembles dementia to a certain extent. So we were giving her those medications to help her with the withdrawals and to help because she hadn't been eating and drinking very well. But we didn't actually give her any treatment for the bizarre experiences that she'd had. And she improved very, very quickly. And within a short space of time, a few days, was really wanting to go home and wanting to go back to the family. We insisted that she stayed for 7 days to complete the alcohol detox program, which is a reducing dose of medication over 7 days, and also just to make sure that the psychotic symptoms, the strange ideas and the voices that she was hearing had gone completely, and it was clear that they had. At which point we gave her a period of time, started giving her time with the family so that she could actually go out with her current partner, start to see the children again, and almost to get ready to be discharged from hospital and to integrate back into the community. I guess the concerns are that she may go out and start drinking again, and there's no way around that. We talked to her about her alcohol abuse. She recognised that it was a problem, but she's in a relationship with someone who also drinks very heavily as well, and there is a chance that she will leave hospital and she will immediately go back to drinking again. She seems fairly committed that that's not going to happen. She seems very clear that alcohol is actually the root cause of the reason why she's in hospital. And in fact, I do believe that the mental health problems that she's had are directly related to her alcohol and not related to other mental health problems at all. And she understands that, and she has good insight into that. Whether that's enough to stop her from drinking again in the future, we don't know. The temptation temptation is going to be there because I don't think her partner is going to stop drinking. So I guess with the two of them drinking, there is potentially a risk to the children as well. There are 4 children at home. I think the eldest daughter is 16, and there's a small baby in the house as well, so a range of ages. And actually the day that she was picked up, she'd left the 3 smallest children, who I think were also 10 and 13, at home on their own as well with the small child. And child social services have been involved in the past. Ultimately, however, there are some protective factors. There is a partner. Yes, he is a drinker, not to the extent that Sandra has been drinking in the past. And Sandra is also very closely supported by her mother, who actually visits every day, stays overnight quite regularly, has the children to stay with her quite regularly, and who is very supportive, and often I think has acted as the surrogate mother for these children when Sandra has been intoxicated. Sandra's very clear that she's not going to drink, and I guess we will see, because we will offer her appointments to come and see us when she's been discharged from hospital, and we will see, and we will have to keep an eye on the situation. There are potential risks though, in terms of her alcohol abuse, but she is very motivated at the moment, and is very concerned. I mean, even from day one of coming into hospital, her main concerns have always been her children, that she needed to leave hospital to go and look after them. As it was, we were aware that grandmother had moved in and was, so that children were safe.
And what sort of mental health support might she get in the community now that she's actually been discharged?
Well, I mean, there's a variety of supports that could be offered. We have offered to make a referral to the community alcohol team, which is a specialist team that works very closely with people who've had alcohol problems, and looks at, I guess, the reasons why people drink and motivates people to reduce their alcohol consumption. I mean, Sandra has refused, no, I say that, that's too strong. She hasn't refused to see the community alcohol team. At the present time, she's saying that she doesn't need to see them because she's so committed to stopping drinking herself, that she doesn't feel that she actually needs any help with that. She certainly hasn't had any cravings for alcohol while she's been in hospital, and she's spent time out of hospital with the family and being able to avoid alcohol completely. I guess my concern might be that in the short term, I think Sandra actually will avoid alcohol. I think she is very motivated. I think it's the longer term. You can't avoid alcohol. You go into almost every shop now and you're confronted with cheap alcohol. Some of Sandra's socialisation has been around going to pubs with friends, which again isn't unusual. So it's very difficult for someone like Sandra, who's been drinking for a long time, to go into a pub and not order an alcoholic drink. And the difficulty might be that 1 might lead to 2 and 3 and 4. Mm-hmm. And I think for a period of time she'd probably benefit from abstinency until she could perhaps get into a healthier relationship with alcohol, where she could go into a pub and maybe have 1 or 2 drinks with her friends and enjoy that without the need to carry on.
And is she at greater risk, Dr. Kinnair, of mental health problems in the future now she has had those psychotic episodes?
The answer is yes. If something has happened once, it's more likely to happen another time. So if Sandra does start drinking again very heavily, there is the chance that she could become psychotic again in the future. And alcohol can cause a variety of psychotic type symptoms. The textbooks all describe in great detail that the sort of hallucinations that someone who drinks heavily can get, and they describe something called Lilliputian hallucinations. So if you've read Gulliver's Travels, when he goes to Lilliput, it's all about very small people, and classically someone who drinks sees very small people and hallucinates these small people. I've never seen it, but it's what's classically described. But certainly you can have visual hallucinations, and Sandra, when she was unwell, described seeing a sort of ghostly white figure. Auditory hallucinations, so hearing voices when there's nobody there. And if Sandra goes back to drinking heavily, then yes, she would be at high risk of developing those sort of symptoms again. And we have explained and gone through that with her. The good news is that Sandra can actually remember very vividly some of the experiences that she had, and is very frightened by some of those experiences. And actually that might help to protect her from alcohol in the future, because she does remember and vividly remembers some of these really distressing things that she's experienced, and she doesn't want that to happen again.
And is there not a duty of care to the children, being that she's likely to relapse in the future?
Well, alcohol is always a very difficult one. I suppose at the moment my hope is, and I think it is important that we have hope, because if we as professionals can't have hope, then what hope can our patients and our service users have? My hope is that she's not going to go back to drinking in the short term, and we're going to be keeping an eye on that situation. I'm going to be seeing Sandra in the clinic. We've asked her to go and see her GP. We've continued her on the vitamin tablets for the present time. Clearly, if Sandra does go back to drinking heavily, there are other people who are responsible for these children as well, not least of which are the fathers. And they also have a duty of care to these children. I think in Sandra's case, the really strong protective factor is her mother, who is, for all intents and purposes, in the short term, moving in to keep an eye on the situation and who will alert us and the GP should the situation deteriorate again. So I think there is quite a lot of protection in place for this particular family. I think if Sandra was more isolated, if she didn't have those other social supports, I'd be much, much more worried. I mean, I haven't contacted the schools, but I think if Sandra didn't have the support of mum moving in with her, didn't have the support of fathers, her partner and the fathers of some of her other children, I'd be much more concerned. We'd probably then be looking at referrals to Child Social Services to go in as an emergency and to put some sort of monitoring in place. And I think they would then be liaising with the schools and other agencies to make sure that lots of people were keeping an eye on the situation. As it is, I think we've got really good family support for Sandra. And I think in the short term, that is reducing the risk. And that's probably the most powerful thing that's going to reduce the risk.
Thank you very much, Dr. Kinnair, for your report in relation to Sandra's case and your involvement.
Thank you.